In this video, we're going to talk about what an exempt employee is. So the Fair Labor Standards Act defines an exempt employee as somebody that is not protected by minimum wage and overtime laws. However, there are two specific tests that both have to be measured on these employees to see if they actually are qualified as exempt. They must be paid a specific salary amount per week, and they must also perform specific exempt duties to be claimed as exempt level staff. So let's break that down. Well, first and foremost, there's a salary level test. So they must be paid at least $684 per week on a salaried basis. Again, $684 a week on a salary basis. Now, the other option is, of course, what's called highly compensated. Somebody who's paid $100,000 per year, that's literally what the Fair Labor Standards Act defines as highly compensated. Now, I know we're talking about healthcare, but if you are a very large home healthcare company, maybe you have computer professionals or IT professionals working for your company. I worked for home health and hospice before, and they had over 60 to 80 people just inside of their IT department because they physically built the products and the technology that they used. Well, to be considered an exempt IT professional, that person must make at least $27.63 per hour to be considered an exempt level computer professional. Now, that's just one leg of the process. The duties test is the next component. So there are things called the white collar exemption, known as executive, administrative, and professional. That's just the acronym I think of. Now, these duties are very specific, meaning that the person who's an executive is typically the owner of a company, but they make decisions that have matters of significance. Everything they do could affect the business, could affect the employees. They have at least so many people reporting to them. I believe it's anywhere from 1 to 3. But on top of that, this person also can make decisions that affect the person's wages as well and also affect their employment. The administrative and professional exemptions are so close together, but basically the administrative is one where they make decisions with matters of significance, but both of these roles actually utilize a great deal of independent discretion where the person is actually not being monitored. They're not being asked to go get approval for every decision that they make. They're utilizing their independent judgment and discretion to make these decisions. So there's a lot of autonomy in these positions. So a person that is exempt doesn't normally require somebody to micromanage their work or to follow along everything that they do. Now, outside of this, there are several other types of options, like outside salespeople. If you're a home healthcare company, I know that the one I worked for had account executives that would go into hospitals and give, flyers saying we provide home healthcare services. So if you discharge this patient, we will see them, and this is our process. And we, of course, write the scripts. If you write with us, we're the best care provider, yada, yada, yada. But on the other end, you also have learned professionals. This is where a lot of the healthcare staff could potentially fall into, but it's very specific. It's not every one of them. So you have to be very careful when you say that, hey, I want to exempt this certified nursing assistant. You have to be very careful with that because those types of folks are not able to be exempted because of their duties. But a learned professional, an example of that would be lawyers, doctors, PhD level folks, people that are in the field of science, technology, somebody that requires an advanced degree. So, in other words, I have to have a master's to be a medical social worker. Or, hey, I have to go through physical therapy school, and I'm basically like a doctor of physical therapy that after I'm done. Registered nurses have to go through a considerable amount of education and specialized training and require a license of sorts to go and practice. So things are a lot different for learned professionals. And then, of course, certain computer professionals as well. So remember, this is the most important component that I can tell you. If you remember this, you will always know that you have to check these things. It does not matter what their job title is. It has no bearing at all. If you call me a manager, that doesn't mean a thing. Just because I'm a manager doesn't mean my salary meets the salary test, and it doesn't mean my duties meet the duties test. Both salary and duties tests must be applied to all workers to ensure exemptions are applied correctly. If you're not sure, you need to reach out to the Department of Labor. If you have inside counsel, go talk to them. It's worth your time. If you have to pay an attorney to look at things, that's never a bad item as well. It's worth the money to spend it. So here's the first example. Josh is a salaried employee who is paid $650 per week and works in a learned professional duties position. So is he an exempt employee? Remember the two legs. As long as you remember that, you won't run into a problem. Well, the first piece, it's basically saying no, because he's paid $650 per week salary, and the exempt weekly salary must be equal to or greater than $684. We're talking about $34 a week, but still, if you don't pay that amount or greater, he's not going to be considered exempt. So therefore, he is due overtime for any hours he works past 40 in a work week. That's important, and so many people make that mistake, and I've seen a lot of different industries make this mistake as well, especially in home health. In the next example, Sarah is an outside sales professional with a home health agency. Is she exempt? If you recall, outside sales professionals are generally commissioned employees and are exempt from overtime due to their job duties and the environment of work. So due to the way and the structure of their compensation and how they are paid and the structure of their position, they are considered exempt from overtime because they are outside sales professionals. They're out in the field. They're going to hospitals. Your staff members who are selling home health services are going to hospitals. You're going to clinics, occupational therapy clinics, orthopedic clinics, and you're selling your services to those folks by, of course, trying to get their business by proving that yours is, of course, better than other agencies in the area. So for sure, outside salespeople are considered exempt from overtime.